Hello everyone and welcome back to my channel and to my last MS Awareness Week video. I can't believe it's the end of the week. I feel like I've put a lot of work into these videos. Doesn't probably look like I have, but I have. The topic that I want to talk about today is disease-modifying therapies. So MS is a disease that currently has no cure, but there is a whole range of disease-modifying therapies that you can choose to go on, or your neurologist might put you on. I know my neurologist said to me, you're gonna have to choose a disease-modifying therapy or I will choose one for you. So these drugs are very powerful. They can modify your diagnosis, but they can't cure it. So I made a video about my disease-modifying therapy, Lemtrada, before. I'll link that in my description box down below. But basically, Lemtrada is a 2-year course. It is a chemotherapy drug that was initially used to treat leukemia, so it is pretty hard-hitting on your body. Basically, the 2-year course involves you going into hospital. The first year is 5 days, the second year is 3 days. And you get it administered through a drip. Got a bruise on my arm. So Lemtrada basically destroys your immune system. It kills off most of the immune system, kills off all the cells that are thought to be the ones that mistakenly attack our myelin sheath around our nerves in MS. It kills off all of those cells with the hope that when they grow back, they will grow back less attacking. So that's what's happened to me. Since having my first course of treatment, all of the lesions that were in my brain have got smaller, which just shows that it has worked. So I'm excited to see sort of December time when I have my yearly MRI what the second course has done for me. Because it is such a big drug, it does come with big side effects. It increases your risk of getting cervical cancer, so I have to get a smear test every year. At the age of 22, I've started to get smear tests because I first had one before I started my treatment last year. When the immune system regrows, it can regrow and attack other things, like it can attack your kidneys, it can attack your thyroid, and you can get thyroid disease, and all of these side effects are potentially life-threatening, so they are quite serious. But it's not as though you just have the treatment and then you're just completely left by yourself. Like, you have a team. I have an MS nurse that checks in on me every single month. Every single month I have to go and get my blood taken and provide a urine sample, and I've got to do that. I've done it for 2 years, so I've got 4 more years of every month going to do that, but I will take that to be able to have the treatment, because the treatment so far for me has been absolutely amazing. I filmed on my Instagram stories this year my day-to-day, what happened whilst I was getting the treatment. So if you are interested in watching those, my Instagram is @izzy_ms, so you can check that out, and I'll also leave a link to it in my description box as well. But overall, it was such a success, this treatment, the second time round. The first time round it was a success too, and this time round it was a success also. I feel like the first time I went, I was absolutely terrified. Like, I didn't sleep for 2 weeks leading up for it. I was having nightmares, I was freaking out. But this time round, because I'd had it done before and I knew that everything went really smoothly, it was fine. And I was just looking forward to it being done, so I didn't have to think about it anymore. And I mean, I've had 2, I went into hospital with my first attack in 2016. That December, I had my first course of Lemtrada, where I stayed in hospital for a week. This year, well, 2017 December, I had my second course. So now I've sort of cut my ties with thinking about hospitals and doing everything. I mean, touch wood. The whole thing went really smoothly. I didn't have the treatment done at the hospital that's near me at home. I had it done in London. So I had a new team of MS nurses looking after me. They were all so lovely and were just really reassuring, and they said I was a very easy patient, to be honest, because everything went so smoothly. I was allowed this time to come home. So last year I had to stay in hospital, which just wasn't great, because hospitals are really noisy and it's just not a nice environment to be in. And then to have this to have chemotherapy every day is just a bit much, but being able to come home was like just amazing this year, and it made it so much better. But in terms of when the infusion was happening, I didn't really have any issues with that. I sometimes had stages where I felt a bit sick, sometimes had stages where I had a headache, but that was quickly addressed and went away. The one thing that I did suffer with quite intensely was a skin reaction. So a skin reaction when you have Lemtrada is completely normal. You basically come out in a full body, burning, raging, itchy rash, and at the most extreme it got, it was quite bad, and I was at a point with it where if it got any worse, I was considering going to A&E. So my rash was at its worst the day after I was discharged from hospital, and I wasn't actually in hospital. So I was basically by myself, and the thing in hospital that really helped counteract the rash was getting Piriton through a drip, but obviously I couldn't do that at home. I could only take antihistamine tablets, which basically did nothing, just made me really drowsy because there were strong kind of hospital ones. So it was getting to a stage where I was considering going to A&E just to get that drip of Piriton, because as soon as that went into my bloodstream, the rash just calmed down so much. And where it was so hot, the rash, and it was everywhere, it made me feel really weak, really sick, really not right, not with it. I felt really out of it. But at the time, it like drove me to tears because it was so horrible. I would go through that probably every single day that I had this treatment just to be able to get the treatment, because I think that the treatment has completely 180'd my diagnosis, and it's amazing, and I would recommend anyone. But yeah, that is the treatment that worked for me, and I feel amazing because of it. It might not work for you. You might have a completely different experience to it. I know that a lot of people feel quite horrid when they're getting their Lemtrada done, and I was really, really lucky to feel fine. But there are so many different disease-modifying therapies that you can choose. I'll leave a link down below to either the MS Society or the MS Trust or something, one of those organisations that have a list of all of the different disease-modifying therapies you can go on, and that's something that you can discuss with your MS nurse or your neurologist if you're interested in starting a disease-modifying therapy. I can't really imagine what my life would be without being on one, because I had a very aggressive onset MS. So yeah, that is something that I'm very happy that, although at the time felt completely horrible coming out of hospital following my first attack and thinking about treatments such as getting chemotherapy and lifelong disease-modifying therapies, I'm so glad that it happened really, really quickly, because I'm where I am now, which I am obviously really, really grateful for. So that was another short and sweet video. If you want to see more of what actually happens when you get Lemtrada, check out my Instagram. I've got each day of my second year as a highlight, so you can watch what happened each day. You can also watch my first video. I've heard some people come back and after watching that video and say that I've really reassured them and made them feel really positive in terms of the treatment, and I think that that's great, and I think that you should feel positive anyway. But that's the end of my MS Awareness Week videos. Thank you so much for watching them. Give it a like, give them all a like if you fancy. Make sure you're subscribed to this channel, subscribe to my Instagram, and I will see you in my next video.